worrying states are Delhi and Karnataka, which have reported a massive surge in cases. The national capital reported nearly 3,000 cases on Thursday, the biggest one-day spike in more than 3 months. Chief Minister Arvind Kejriwal has called for an emergency meeting with health officials. As for Karnataka, the state registered more than 4,000 cases, with Bengaluru accounting for nearly one-third of the surge. I'm joined by Arun Dhanta reporting from the national capital and Revati Rajivan reporting from Bengaluru. Good morning to both of you. Arun, I'll come to you first. Decode the latest from the national capital.
Well, Ayushman, good morning to you and to our viewers. First of all, the situation in Delhi is very catastrophic. As we know that in last couple of days, there's massive surge in the Covid-19 cases. If you take up the example of yesterday, 2,790 cases have been reported in 24 hours, and therefore the positivity rate has also gone beyond 3%. 3.57% was the one which was recorded yesterday, and the numbers speak for themselves. Now, as we see today that Delhi Chief Minister Arvind Kejriwal, along with the Health Minister Satyendra Jain, with the other officials, a meeting will take place at 4 p.m. at his residence, which is going to be very, very crucial, because in this meeting they will be deciding the future course of action as to what can be done in Delhi. And remember that in last couple of days, testing numbers have been reduced in Delhi, and still we have this massive spike in the cases. Now, there are a couple of problems which we see here in the national capital. The following of the SOPs of COVID-19 is not properly being adhered by the people. And this is not only the fault of people. We have seen that how political parties and the government is not sending a message which is needed, because we are seeing that elections are taking place and there is a huge congregation in the rallies. That's something which is a worrying sign, and the message is not coming from the top, which should be percolated down to the masses as well. So that's very important on the part of government and the other political parties, that they send a right message from the top. And secondly, we are also seeing that people are flouting the norms. We have done our ground reports from different parts of Delhi. People are not maintaining social distancing, they're not wearing masks, and that too when repeatedly appeals being made by the governments that these are the basic things that needs to be followed, and thus we are seeing that how this spike is taking place. Now, yesterday we have seen the order has come from the Directorate of Education Delhi, in which they have asked that the next session, which is of course 2021 and 2022, will not commence offline in the schools. However, the classes will start online, but offline till further order will be closed, and the students of the previous session, like 2019 and 20 of the 9th, 10th, 11th and 12th standard, might be called into the schools for some projects and the official works, and that too after the consent of the parents and the guidelines are being followed by the school authorities. So these are the things which is happening in the national capital. Yes, it's a worrisome sign, the way cases are going up, and people are saying, experts are saying that this is the second wave which they were expecting to flourish in Delhi. So in coming few days, it's going to be very, very crucial as to what happens. And today's meeting also, remember Ayushman, is going to be very, very crucial, in which Delhi Chief Minister Arvind Kejriwal is going to chair that meeting, and then only what transpires in that meeting for coming few weeks, that's something which we'll get to know.
Right. So that's the latest from the national capital. I'll shift focus to Bengaluru now. I'm joined by Revati Rajivan on the broadcast. Revati, Karnataka registered more than 4,000 cases on Thursday, with the maximum coming from Bengaluru. Decode the factors behind the surge.
Yes, and Karnataka registered more than 4,000 cases for the second consecutive day. We're seeing a very steady increase as far as Karnataka is concerned, and of course, the majority of these cases coming from Bengaluru urban. Of these 4,000 odd cases, close to 3,000 cases come from Bengaluru urban, rest of it spread across the other 30 districts. Now, other Mysore and Kalaburgi too are seeing worrying trends, but just more than 100 cases coming in from both these districts, and rest of the districts less than 100 cases. So if you look at the comparison, it is 100 odd cases in say Mysore, Kalaburgi, less than 100 in other districts, and in Bengaluru it is 2,900 plus cases. That is the kind of difference that we are seeing in numbers as far as districts within Karnataka goes. Now, two things here. One, the majority of these cases coming from interstate travelers as well. Bengaluru has a mix of population of people coming in from other neighboring states as well, from Maharashtra, Kerala and other parts. Of course, they're coming from other countries as well at this point of time. So the health department telling us that majority of these cases come from interstate travelers. Secondly, this during the second wave, the numbers that we are seeing in that, a majority of cases, an increase in rise in cases among the 20 to 40 age group is something that we are seeing in the second wave. Last wave, of course, the people above 60 were the most vulnerable. They were the most cases were seen in that particular age group. But this time, for two reasons. One, because this age group is getting out, mixing up with crowds, and also getting out to work. For all these reasons, there is an increase in cases that is being seen within the 20 to 40 age group. Also, above 60 years of age, there's vaccination that's being done. There's more than 19 lakh senior citizens have been vaccinated in Karnataka. So probably that is another reason why the case surge in the 20 to 40 age group compared to the above 60 age group. So these are the major highlights as far as Karnataka's numbers go. But as far as the situation on the ground goes, everything is open and resume activities are going on 100%. But yesterday, in fact, the Primary and Secondary Education Minister's office informed that classes 6 to 9, offline classes of 6th standard to 9th standard will now be cancelled due to the surge in COVID cases. Their exams too, a decision will be taken after discussions with the concerned authorities. So that is the situation, a worrying trend as far as Bengaluru is concerned, and which is contributing to the overall cases in Karnataka as well.
The relocks are also expanding. I'm also joined by Runjun Sharma on the broadcast, who tracks the Union Health Ministry. Runjun, good morning. Runjun, the surge is continuing. The situation in the hotspots is getting worse. Decode the latest from the Union Health Ministry.
In fact, over 72,000 cases we saw yesterday, and what experts are pointing out is that the peak may reach in the second half of April, and the cases could be as high or more as a lakh a day. And this, in fact, is something, but considering the fact that states still continue to be lax. We're still seeing public gatherings, whether, say, on Holi, in fact, in hold-down states, the gatherings that you see, nobody wearing masks, no social distancing, no COVID-appropriate behavior. This exactly is where the virus breeds. And in fact, this exactly is the reason why we're seeing the continuous spike in the cases that are being reported every day. Of course, Maharashtra continues to top that list. But apart from Maharashtra, Punjab, Chhattisgarh, Madhya Pradesh, Delhi, these are also states that are seeing a surge, and states that need to test more as well as vaccinate more, according to the Health Ministry. In fact, a word for Punjab, the Health Ministry says that neither is Punjab testing enough, nor is it properly isolating the people who are being tested positive. That's the reason why we're seeing a surge. Really extremely important at this point in time that states really follow the order which is given by the center. One of the orders, of course, being the fact that in every district, they need to make sure that 100% of the population which is eligible for vaccination, which is 45 and above, need to be vaccinated. That's how they can protect people. Remember, the mortality rate is also going up in the country, another sign slowly, and which is why extremely important in this time in time that we vaccinate more. Ayushman.
Thank you.